31 after 11. Good morning, Doc.
Good morning.
How are you doing?
I'm good. How about you?
I'm doing well. I'm glad you're looking pinkish today.
Yeah, I mean, it's Pink October, so I can't do anything else but to be in pink.
Tell us a little bit about yourself before we get into our conversation.
All right. So my full name is Dr.Kwame Owusu Mensah.
Okay.
I'm a medical practitioner with Saqs Healthcare.
Okay.
And also a surgeon in training. Almost done.
Oh, that's good.
Yeah.
Okay. Anyway, so we're going to talk about breast cancer. Tell us what we should know about breast cancer.
I mean, it's not by any coincidence that for the whole of October, globally, we set it aside to talk about breast cancer because it's a disease that's causing so much menace, especially among our women, but also it affects men. The difficulty with breast cancer and the reason why we are creating this awareness is because it's a disease, and when it comes to cancer-related deaths, as in women dying from cancer, breast cancer alone in our part of the world constitutes about 40% of those deaths. And unfortunately, in our part of the world, most of the women who suffer breast cancer do not come early. And so this month, you set it aside to talk and make noise and do a lot of advocacy about breast cancer so that women will come early. Because elsewhere, about 80 to 90% of their patients, I mean abroad, come early. They come once they see the signs or the symptoms. And so their survival rate is higher. But here is the other way around, unfortunately. About 80%. So if you have 10 women with breast cancer, 8 out of 10, when they come, it has already spread. And once it has spread, there's very little we can do.
For all you know, they saw it and they were trying to treat it with hey baba.
Exactly, that's
and
the
then
challenge.
Some concoctions.
Exactly. And that's why this month we are creating more awareness about breast cancer. That once you see any change or notice any change in your breast, kindly come to the hospital, because the earlier you come, the better the prognosis, and we can prolong your life.
But how does it develop in the body? Is it what we eat? Is it something we do?
I mean, God is wonderful, isn't it? When we are born, we don't have the breast.
Yes, we don't.
Yes, but once you reach puberty, due to hormones, principally the one that we call estrogen.
Okay.
So because of the surge in estrogen, you start to develop the breast. And this continues to probably menopause when the levels drop. So we can't really pinpoint exactly what causes the breast cancer, but we know that there are factors that when they come together, will lead to breast cancer formation. I mean, once you get to your puberty, you develop the breast. It's not that huge. It starts small, isn't it, estrogen? So naturally, God in his wisdom, whilst you are growing and the breast is growing, some of the cells are supposed to die so that it doesn't become very huge, so that it regulates the growth. But for instance, if all the cells are going right, a stubborn cell will come and decide to go left. And because of that, there is no control. And once it goes and there is no control, then that's what we call cancer. It's commoner in female than in males.
But a male could get breast cancer.
I have patients who are males and they come in with breast cancer.
What is the breast?
Once you have, breast, you can get breast cancer. So it's more common in females. And you can't change the fact that you're a female, unfortunately.
Yeah.
So if you're a female and you're listening to me or watching me on live on Facebook, this is an opportunity for you to the higher your chance of getting these cancers, for example, breast cancer. So women above 40 years have a higher risk. But that notwithstanding, let me throw this caution in that I've seen ladies in their 20s who come in with breast cancer. Yes, it's possible.
So then that brings me to my question. At what age should we start paying attention to our breasts?
Once you develop breast, start paying attention to it. Once you develop breast, start paying attention to it. But the fact that, as I said, once you are aging, there's a higher likelihood. So the recommendation is for every woman, or for everybody, especially for women, once you have your menses, listening to me too, you can learn how to do it so that you do it for your partner, okay? so it's a monthly thing that you have to do. But when it comes to coming to the hospital, then the recommendation is once you are 35 years and above, you come and regularly, maybe 6 monthly, then we screen you. But for women above the age of 4, called mammogram. So mammogram is a form of X-ray that we do purposely for the breast to check if there are any abnormalities. So once you hit 40 and you do the mammogram, if there is a change in it, we will notice it very early and intervene. So if you can hear me and you are about 40 years, you've not done a mammogram in your life, you have to take the opportunity to do one this month. So that's basically the screening.
Okay, so let me take you back a little to the young ones who are listening. So you said after your menses, you should screen your breast yourself.
Yes.
How would you go about that?
It's not difficult. If you are hearing me, you can just go online, YouTube, search for self-breast examination.
Okay.
Self-breast examination.
Okay.
Self-breast examination. Or kindly come on Facebook. I'll be demonstrating how you examine your breast.
Yes.
So it's not difficult. Get a mirror. Get a mirror in front of you.
Okay.
Then once you have the mirror and you undress, and you stand in front of the mirror.
Okay.
So you are looking at both breasts in the mirror, checking if there are any skin changes. You see how the peel of an orange is. You see these dots on the orange.
Yeah.
Once you see something like that on your breast, the skin of your breast is abnormal. You come to the hospital. So those are one of the things you're looking out for. If you see any ulceration, any wound on your breast, you have to come to us. If you notice that there is any change in your nipple, the shape of the nipple, the direction of the nipple, normally most people probably is pointing downwards. But now you notice that you're pointing more to the left. It could be abnormal. Come to the hospital. So when you stand in the mirror, that's what you're looking at. And you raise your hands slowly. If you're not on Facebook, kindly come on Facebook so that you can see what I'm demonstrating. So raise your hands slowly. Whilst you're doing that, you are looking into the mirror to check if there is any place in your breast that's going down instead of coming up. Because once you are raising your hands, the breast also
it should come up.
Yes.
Okay.
But if there is a swelling in it, a lump, that place will go in.
Okay.
So once you are done with that, then you are now coming to examine the breast. But I must say that the breast is not just the tissue we see in front of our chest. It goes into an...
so that means your hand should go this way.
Exactly. So when you are examining, the recommendation is divide your breast into 4.
Okay.
Okay. You divide it into 4 zones. So up, in, up, out, lower, down, lower. Then you palpate or you press your breast tissue against your chest wall.
Okay.
Okay, in a circular fashion. So you go circular fashion. You move it slowly, circular fashion. Slowly.
Okay.
And I'm saying hold your breast, you feel there's something in it. That's not what you're looking for.
Yes, I was about to say that.
Yes, that's not what you're looking for. If you press this against your chest wall, if there is something, a ball-like mass or anything like that, you feel it. You feel it, and you come to the hospital so that you have a look at it. Okay. And the last place you press is your nipple area. Then you go into your armpits, because the breast tissue extends there and it drains there. So you also examine that side. You do it for your right, you do it for your left. If you find anything that you feel is not normal, you come to the hospital and we will attend to it. So that's how you examine your breast. Thank you.
Okay. And how can people overcome the fear? Because they feel that, what if I come and you guys say I have breast cancer?
I mean, that's rather unfortunate. But you see, the secret is the earlier we diagnose you, the better. I believe most of the fear comes as a result of, because when you come and you have breast cancer, you might have to cut off your whole breast.
Yeah.
And people, there's stigma, and they will be looking at you and probably you did something wrong. That's why you've developed breast cancer or not. But that's not the case. The hospital is actually a place for everybody, especially at Saqs. You are very friendly. You have friendly staff. Your privacy is well assured. Okay. So once you come in, don't worry about that. Your confidentiality is top notch, and we will screen you. And as I said, early diagnosis saves life.
Okay.
If you come in very early and we examine you and we diagnose you of breast cancer, there are times that we don't have to take off your whole breast. We can just do surgery to remove that part that the cancer is.
Okay.
And that's why we are creating this awareness. Come early. We will remove only that part for you. We'll put you on radiotherapy, and you are good to go. Your breast is still in touch. The cancer is gone. And survival rate is very high in that regard.
So, are there any lifestyle changes that can help reduce the risk of breast cancer?
There are. One aspect of the risk factors, what puts you at risk of getting breast cancer, are called modifiable risk factors. So it means you can do something about it. One of them is what you eat. I can't overemphasize this point. We say it all the time, not just with breast cancer, what we eat. Unfortunately, nowadays we feast on a lot of junk food, a lot of oily stuff, all these meats and all that. But the recommendation is taking fruits and vegetables. Less fats, less oily foods. It helps. The other bit is exercising. Exercising also helps, because if you are obese, so obesity is a very known risk factor for breast cancer. So losing weight through exercising and dieting also helps. Okay. So these are things you can do to reduce you're at risk. And screening too is very important because early detection saves lives.
Yes.
Yeah.
Before I come to how Saqs can help, SM, please, the breast cancer questions, ticket in why I won't give you any ticket. Okay, so he says, let me watch some. I'll teach all my area girls. I hear. Alignment Fashion is asking, so Doc, can I also examine so can I also examine ladies' breast in my shop, or is for doctors alone? This one, dear. Alignment. I can't pressing somebody's breast.
You can't.
In your shop. You are not a certified doctor.
You can't.
Please don't do that.
Yes.
Anyway, so what services are Saqs Healthcare offering this month?
Yeah, so this month, Saqs, we are having free breast screening for everybody that walks in.
Okay.
So during our working hours, we have 2 branches. We have one at the mall.
Okay.
We have one at Ademra TUC. So walk in, free of charge. We have qualified personnel who will examine your breasts. So any day of the week that you pass through the mall, make it a point to pass through the clinic so that we examine you. Then every Wednesday morning at 8:30, between 8:30 and 11 a.m., we have a clinic solely for breasts.
Oh, okay.
A clinic solely for breast every Wednesday morning. So that one you can come in and have a conversation with your doctor.
So what message would Saqs Healthcare like to leave the public this Pink Month?
So Pink October is basically about creating awareness for breast cancer. And our message is very simple. That's you have to self-examine or come for you to be screened because early detection saves lives. Early detection saves lives. And if you are if you are listening to me and you have a relative who have breast cancer or you have suffered from breast cancer, Saqs Healthcare wants you to know that we are with you and we are supporting you in our prayers. And if you have any problems or anything, you can come to us. Our services and our doors are always open for you. Thank you.
Okay, thank you very much for the education. But Doc, before you leave, okay, Lizzie has a question. Lizzie is asking, please, where can I locate them? Having a lump on the breast of the skin, and I was told it's a normal lump that contains fat, and was asked to come for a minor surgery, but I didn't go back again because I had a keloid after I had a surgery. So I was scared that I might have it when I have the surgery on my breast.
Yeah, so it's not all lumps that are cancerous.
Okay.
Finding a lump doesn't mean you have cancer. We have to do further tests to make sure that really is cancer. But for her, it's not cancer. So it can be removed. Services.
But she's saying that because she had surgery some time ago and she developed keloid.
Oh, we have a way around it. Come and see our surgeon. We have a way around it. We will solve it for you. So we are at the mall, Kumasi City Mall, opposite Telecel office. You can look.
And Lizzie, I know they close at 8 p.m. So
yes. So for her, she should come on a Wednesday morning.
Okay,
after
Lizzie.
8 to about 11 a.m.
Sacrifice one Wednesday.
Yes,
that's Wednesday. Don't sell water. Why?
Yes. You should
come to the breast clinic. Come to the breast clinic and get screened. Okay. Yes. So I think that's about it for the questions. So Doc, before you leave us, we are asking this question this morning. Why are you laughing, DJ Freeze? Why are you laughing? So we are asking that what tastes better than it smells?
Tastes better than it smells.
Yes.
Ooh.
Some people are saying dawa in jollof. Some people are saying momone. As for what's an unperchum said, I can't say it on air.
I think I will side with momone.
You side with momone?
Yeah, the smell of momone there is terrible, but
when you taste it, it's good.
You have to have a taste of it.
Okay.
Then even though it smells that bad, you go back for more. Yeah, so I'll side with that one.
Okay.
I will.
Okay. Thank you very much, Doc.
Sure. Always a pleasure.